Hi there, welcome to Excel Health Arena. We started discussion on infertility and I've given a general overview of infertility. I've also given a general overview about the causes of infertility. This time around, we are going to pick those causes one after the other. And I will want to start with the male infertility. May I quickly remind us that I said 20 to 35% the woman is responsible. 20 to 30% the man is responsible. It will interest you to know that men also can be reasons for infertility more often than you expect or you can imagine. Come with me as we talk about male infertility. Now, the most common cause of male infertility has to do with the sperm. The problem with the sperm could be in terms of problem of motility, that is the movement of the sperm. It could be in the aspect of the shape of the sperm or the amount of the sperm. When we talk of the shape of the sperm, if the sperm that is produced is not in the correct shape, it alters the ability of the sperm to fertilize. Another thing is if the sperm is not strong enough, the motility, the ability to move fast, sperm can be very, very motile. So the ability for the sperm to move fast, if it is reduced, there is high tendency or possibility of infertility in the man. If the sperm is too scanty, now listen to this very well. I said if the sperm is too scanty, I'm not referring to the quantity of semen, because semen could be much, but the quantity of sperm inside the semen may be reduced, may be very, very little. So if the amount is too low compared to the quantity of the semen itself, that means what is important in the semen is the sperm, and once it is in reduced quantity, there is also high tendency of not being able to produce the one that would actually fertilize. Ordinarily, you may want to say that, after all, how many sperm fertilizes? It's not as if so many, a woman requires so many sperm to fertilize an egg. Yes, you are correct. But the fact is, out of the many sperm, don't forget that it's not all of them that will find their way up there. So the lesser the amount of sperm, the more reduced or the lesser the chances of impregnating a woman. So now that is about the problem of the sperm. Other causes of male infertility includes enlarged veins in the scrotum. We call it varicocele. So if there is varicocele, that is the enlargement. It's an inflammation and enlargement of the veins in the scrotum. Scrotum is the sac that holds the testes or the testicles. In a situation like this, there is possibility of infertility. Then there could also be genetic disorders. There is a particular genetic disorder, we call it cystic fibrosis. In cystic fibrosis, there is a form of genetic or gene mutation which primarily affects the fertility of a man due to congenital bilateral absence of the vas deferens. Vas deferens is the tube, is the pipe that takes sperm from the testes into the outside. That is the tube. That is the tube that is cut when a man wants to uptake family planning by surgical intervention. That is the permanent family planning for man or for a male, which requires the vas deferens to be cut and tied. In a situation like that, once it is cut, it's just like the bridge is cut and there is no link between the testes, between the sperm in the testes and the outside where the man is ejaculating to be able to impregnate a woman. So in such a situation, there won't be pregnancy. So cystic fibrosis brings about the absence of the vas deferens bilaterally, both of them. And once the vas deferens is not there, don't forget, it is not the problem of the testes. It is just the problem of the link that carries the sperm from the testes into the vagina or into the outside for the woman's egg to be fertilized. So in a situation like that, there will be infertility. There could be anatomical obstruction of the vas deferens, which prevents the sperm from passing through the vas deferens to the urethra and of course to the outside, for the man to be able to bring sperm outside to fertilize the egg. In such a situation, there may be infertility. There could also be chromosomal disorders. These are disorders of the chromosome. So we call something Klinefelter syndrome. They also refer to as, to it as 47 XXY chromosome. That is XXY chromosome 47. In this situation, the chromosomes that make up a male child is XY. The one for female is XX. So a male child in this situation, the male child, when born, has an extra X chromosome. This extra X chromosome makes it 2 X's and 1 Y, XXY. And when a child that is born with that congenital abnormality is, born into the world, what happens is the child has long legs, very small manhood, very, very small manhood, small trunk. The trunk here could be small, the manhood will be small. Then the testicles will be there, but will be poorly functioning. They won't function well. They will not be healthy enough in that situation. So that can also be a congenital abnormality that will be responsible for infertility in males. Many a times we talk about males packing both the scrotum and the manhood in a way that it will not be too much, attached to the body, because the body is capable of producing some heat. And in a situation like that, these are organs that are better, kept in a heat-free environment, because it destroys sperm. So any man that, there are occasions when the man's nature of job will even be the one that it makes him to expose his genital area to heat. In a situation like this, it is very, very dangerous, because it is a primary cause of infertility in male. And another thing is, if there is low testosterone. Testosterone is the hormone of the men. It's the male hormone. If there is misuse of a particular steroid, some people take that steroid without medical advice. They take it to increase the muscle mass and improve their athletic performance. For athletes, when they use that kind of drug, they take it often. It has a way of reducing their testosterone. And when that happens,